These are not the random MCQs. These are the questions that the exact concept that will determine you will repeat or pass your FPG, PEBC and OPERA examination. In today's Friday Pharma Quiz, we focus on the high-yield scenario-based diuretics related questions. So don't think and guess, but think like an examiner. That will determine you will pass or fail the examinations. And the most important thing is the majority of the students are failed not because of the memory, because of they don't have understanding in a logical perspectives. Okay, so we dive into the questions and understand the logics behind these questions and why this is the right answer. That will add more value in your learning process. Okay, so let's start the question. 72-year-old male with the acute pulmonary edema and chronic kidney disease with the glomerulus filtration rate is 25 ml per minute and is given IV furosemide, but the response is poor. Which strategy will most likely to improve the diuresis? And your options are this. So think for a couple of seconds and give your response into the comment box. I hope you have analyzed the proper problem in this way. The person is taking the strong diuretics like a furosemide, but he is not getting the enough diuresis effect with this. So in these situations, we have to add the one more diuretics in order to get the proper diuresis and resolve the problem of pulmonary edema. That means the nephrons are stuck at this point of time, so we have to give two different kind of diuretics that work at two different site of actions and that can promote the diuresis. So definitely in this situation we have to give the medication that act at the different site of actions like hydrochlorothiazide. Loop diuretics acting at the loop of Henle and the hydrochlorothiazide is acting at the different site of actions. So when we are giving these two medications, that can stimulate the diuresis and we can get the effect and the pulmonary edema is resolved in these situations. Okay, so you are right. So this is the answer, hydrochlorothiazide. That's a sequential nephron block and we have to give it two different diuretics in order to get the proper benefits. Okay, jump into the question number 2. The question number 2, a patient received high dose furosemide and developed metabolic alkalosis. Okay, think about it, metabolic alkalosis. What is the primary mechanism? Options are here. Guess for a couple of seconds and give your response. Why this patient is developing the metabolic alkalosis? Your response? Now, let's understand the logics behind that. So when we are giving a furosemide, that is going to waste the hydrogen ion. That means the body is excrete out the hydrogen ion. So urine is become more acidic, but the body is deprived of hydrogen ion. And in that situation, the body is become more alkaline. Okay, in this situation is called the metabolic alkalosis. So what is the reason behind that? Because the increased hydrogen ion loss in urine. So pH of urine is more acidic, but the body is alkaline, okay, because the acidity has been reduced. So that is the primary reason behind that. And this is the very, very common question you can expect in exam about the urine acidosis and alkalosis and metabolic acidosis and alkalosis. So urine pH and the body pH. This kind of questions you can expect in your exam and you should be at the position to give such kind of answers in a proper format. So majority of the students are failed because not they have any problem with the memory, but they don't have a proper logic to give the response. Okay. So we have to give the answers with the logic. Increase the hydrogen ion loss in urine, and due to that, the patient is developing the metabolic alkalosis. Okay, so now jump into the question number 3. A patient with a heart failure, it started on the spironolactone in addition to ACE inhibitors. Heart failure, spironolactone, ACE inhibitors. Which laboratory parameters require close monitoring? This is also very important question for your exam point of view. These are the options. Think about a couple of seconds and give your response. If these questions are adding any kind of sense to your thought process or logics, then definitely you have to check this playlist where we have put all the Friday Pharma Quiz related videos, and that can make your learning process much more faster and easier to get the better understanding of these concepts. Okay, so let's jump into question number 3. This the ACE inhibitors and spironolactone. Both of these medications are increase the potassium level in the body, and due to that increase the risk of potassium related arrhythmia. So we have to closely monitor the patients for the potassium level. Okay, that's called the hyperkalemic situation can happen with this combination, and you have to understand this concept because it's a very common question in your exam. Serum potassium level. Now the question number 4, a hypertensive patient with the recurrent kidney stone and also the hypertension, okay, is a prescribed diuretics that reduce the urinary calcium excretion. Which drug is most appropriate? Okay, so these are the options. You think about it and give your response. If we are giving furosemide, definitely that can increase the calcium excretion, and the level of calcium is increased in your urine, and that also build the crystal and cause the problems like kidney stones. So in such kind of situations, we have to give medications that is not impact with your the calcium excretion. So hydrochlorothiazide is increase the calcium level in your blood, that is not causing the hypocalcemia. That doesn't cause the hypocalcemia. That means the urine calcium excretion is not happen with the thiazide diuretics, and that's why that minimize the risk of kidney stone. If you are going to stay till the end of the video, you are going to get the one screenshot that can save your significant marks in FPG, PEBC and OPRA examination, because in that one screenshot we have explained all the concepts related to diuretics in 5 seconds. Okay, so that is a very valuable point. You must have to take a screenshot at the end of the class. Okay, so hydrochlorothiazide, that is increase the calcium reabsorption, means the calcium loss is not happen with the thiazide diuretics, and that's why that prevent the calcium stone in kidney. Now the question number 5, a patient is on acetazolamide and develop the tingling sensation and fatigue. Which acid-base disturbance explain this effect? Okay, which acid-base disturbance explain this effect? So these are the response, these are the options, and give your appropriate response. Okay, acetazolamide that excrete out bicarbonate, so urine become more alkaline. Lekin what happened? The body is become more acidic. Okay, so that is called the metabolic acidosis. That is the problem associated with the acetazolamide, and due to that metabolic acidosis, the patient is experience such kind of sensations. Okay, so this is the metabolic acidosis. Why metabolic acidosis? That is more important compared to just guessing. Okay, the logic. So that is excrete out the bicarbonates, and due to that the deprived the bicarbonate in body, and that is causing the metabolic acidosis. Okay, so now the question number 6, which diuretic is contraindicated in patients with hepatic cirrhosis due to the risk of hepatic encephalopathy? This is very interesting and important option. Okay, so here is the mannitol, that the osmotic diuresis, that is the primary the mechanism of action, and mainly the mannitol is used for the intracranial pressures and cerebral fluid accumulation. Those kind of problems can be resolved with the mannitols, but in cardiovascular problems and hepatic problems we are not giving mannitol. This is very important point you must have to remember for your exam. Mannitol is worse the fluid shifting and precipitate the hepatic encephalopathy. Okay, so patient with glaucoma is a prescribed diuretic that reduce the intraocular pressure. Which drug is used in these indications? So it's a very unique kind of indications associated with which kind of diuretics. So your options are here. Give couple of seconds and give your response in the comment box. Yes, you are right. That's the acetazolamide, carbonic anhydrase inhibitors. Acetazolamide has a 3 unique kind of benefits. One is glaucoma, Second is that is also used in high altitude sickness. Okay, so in high altitude sickness is also used. And the third important use of acetazolamide is in seizure. Okay, patient those who are suffering from epilepsy also they can get the acetazolamide. So that's a different kind of diuretics. And the most important point is that's the bicarbonate anhydrase inhibitors. But the major problem associated with the acetazolamide is that can cause the metabolic acidosis. That is important. Okay, so this is the point, your explanation. Now, jump into the question number 8. A hospitalized patient receiving IV loop diuretics and develop hearing loss. What is the most likely cause? Okay, that is called, it's simple, very easy. The name itself is indicating the problem. So, your answer is almost right. Okay, that's the ototoxicity at the high peak level. Okay, question number 9. Which diuretic reduce the lithium clearance and increase the lithium toxicity risk? Your options are here. Yes, you give your response into the comment box and definitely your answer is right. If you are giving a right answer, that means you are thinking like a licensing exam pro. And if you are struggling with the right answer, you don't worry about it because you are in the process of learning and this the learning is happening in your brain. But you are taking a proactive steps and giving your response into the comment box. That is more valuable compared to right or wrong. Okay, so this is the hydrochlorothiazide. Hydrochlorothiazide is impaired the clearance of the lithium, and due to that, that increase the lithium plasma concentration. That is the narrow therapeutic window medication, and that cause the lithium toxicity. So when the patient is taking a lithium for the bipolar disorders, always we have to be very careful about giving the diuretics like the thiazide diuretics that increase the risk of toxicity. Okay, so hydrochlorothiazide. Now, the question number 10. A patient with the brain injury is given a diuretics to reduce the raised intracranial pressure. Which drug is used? In this situation is a mannitol. Mannitol is the most important substance that used for the cerebral encephalopathy, or it's the problem related to the fluid accumulation in the brain. Okay, so mannitol is the osmotic diuretics. Now, take the screenshot at the end of the 5 seconds and you are going to amazed. These concepts will save your marks in FPG, PEBC and OPRA examinations. So let's quickly recap the whatever we have learned. Loop diuretics. Loop diuretics, that's cause the hypokalemia. That means the potassium waste, and due to that potassium waste also that's the hydrogen is going to be excrete out and cause the metabolic alkalosis. And the third important point you have to remember is ototoxicity. So when we are giving loop diuretics with the other medication that has a ototoxicity, that cause the synergistic problem of ototoxicity. Okay, so like antibiotics, certain antibiotics can cause the loop ototoxicity, so we should not have to give the furosemide kind of medication with those medications. Okay, like a gentamicin. Okay, thiazide diuretics that should not be given to the diabetes patient because that increase the blood glucose level. And second is the gout patient, we have to be very careful because that increase the uric acid level. And the third important is the preferred medication for the kidney stones patients, because that is not increase the level of calcium in your urine and it's the prevent the crystal formation in the kidney. So the diuretics, these are the 3 important points we have to remember. The fourth is the mannitol. About the mannitol, we have to remember this medication is given for the brain-related edema that reduce the intracranial blood pressure, but we should not have to give to the hepatic and cardiovascular patients. Okay, mannitol should not be given to those patients. Now, the sequential nephron block means the nephron at the multiple angles we have to stimulate the nephron in order to get the proper diuresis effect, and that's why we have to give the combination of the loop diuretic and thiazide diuretics, because these 2 medications act at 2 different sites of nephron. The question number 5, point number 5 is a spironolactone. Spironolactone is considered as a potassium sparing diuretics, so that can cause the hyperkalemia. But we have to be very careful with the combination ACE inhibitors and ARBs that significantly increase the potassium level and cause the major problems. And the another thing is spironolactone is aldosterone antagonist, so that cause side effects like a gynecomastia. This kind of problems are associated with the spironolactone. And the last but not the least, acetazolamide that decrease the bicarbonate level and causing the metabolic acidosis. Take the screenshot of these slides, and that can significantly add value in your learning process. Okay, and that save your significant marks in your FPG, PEBC and OPRA examination. If you like such kind of concepts, then definitely we are going to see you in the next Friday Pharma Quiz. And if this add any value in your learning process, then subscribe the channel so you are going to don't miss any upcoming videos. Okay, thank you very much and see you in the next week.